A very warm good evening to respected judges and fellow presenters. My topic of today's presentation is comparative evaluation of post-op refraction in patients operated with 4 different brands of IOL. The purpose of the study is to compare visual outcomes after cataract surgery using 4 IOLs of different prices but similar properties. All the lenses are monofocal hydrophobic acrylic but belong to a variable price range. It is a prospective randomized controlled clinical trial, duration of 6 months, and included 125 ISO 120 patients who underwent phacoemulsification and IOL implantation. Eligible patients were randomly assigned to one of the 4 different IOL implantation groups according to the patient preference in lens selection. These are the IOLs used. And the patients were excluded based on there is no history of ocular inflammation, trauma, diabetic retinopathy, uveitis, glaucoma. This ensured that the study focused on a homogeneous group of patients with primary age-related cataract, and the preoperative assessment included ophthalmic evaluation and biometry using IOL Master 700, which provided precise measurements, and axial and keratometry and IOL powers were calculated. So the preoperative data consists of the mean age of the patients in each group, sex distribution, mean axial length, and keratometric values. No statistically significant difference between 4 IOL groups with respect to axial and keratometry. Hence, the visual outcome following cataract surgery is unlikely to be affected by these parameters. And the surgery was performed by a single experienced surgeon using standard phacoemulsification techniques, and the selected IOL were implanted into the posterior chamber. And the post-operative assessment was conducted on day 1, 7, and day 30, and the following parameters are recorded, and there is no intraoperative or post-operative complication in any of the study group. So the results are as follows, and the table presents the mean logMAR values of the post-op vision in post-op day 1, 7, and 30 of 4 different IOL types, and it includes spherical equivalent values which measure the refractive error after surgery. And this is the data. Before surgery, mean patients had poor vision, which is less than 6/60, and on post-op day 1, there is significant improvement, but some patients still have vision in the range of 6/18 to 6/36, and post-op day 7, there are many patients with a higher proportion reaching 6/6 to 6/12, and on post-op day 30, most patients have 6/6 to 6/12 vision, indicating successful visual recovery. And the uncorrected and the best corrected visual acuity were analyzed on the final 4th week follow-up were considered. And the uncorrected visual acuity, as lens, there is a majority of patients fall into the 6/6 to 6/12 category. In IHANS compared to S lens, there is less number of patients with in the 6/12 category, less than 6/12, and smaller portions. In Alcon, best uncorrected visual acuity results are seen. And in the best corrected visual acuity S lens, majority of patients have 6/6 BCVA, with smaller proportions having 6/9, and the Alcon highest number of patients achieve 6/6. So the overall trend suggests that all patients perform well, with most patients achieving good visual correction. So there are few limitations of the study. The technique IHANS is not a pure monofocal IOL, and this study size is small. So the conclusion is there is comparative visual outcome achieved in patients implanted with acryls of ICE lens and Hoya ICET, and those implanted with IHANS had relatively lesser proportion achieving 6/6 too. So for patients who cannot afford high-priced lenses, there is no significant difference in the obtainable visual acuity post-surgery. Thank you for your kind attention.
So these lenses seem to be all higher end only.
Like 3 are imported and 1 is India-based company.
Okay.
So,
what were the reasons for the vision between 6/9, 6/12 for IHANS?
IHANS, it might be because post-op corneal edema. So, and ultimately the IHANS, the distance vision following after correction, majority patients achieve 6/6. So the overall result of IHANS is better because there is intermediate correction. So patients were very comfortable post-op with IHANS.
All right. Thank you.
Thank you.